ABC 17 News investigates how Boone County handled mass vaccinations as it prepares to do so for the coronavirus.
This isn't the first time Boone County health officials have had to plan for an event like this. ABC 17's Molly Stawanoga uncovers what you can expect when coronavirus vaccines go public.
Health officials at the Columbia Boone County Health Department tell me they are prepared for mass vaccinations. I got my hands on these plans for swine flu vaccines from 2009. Both the H1N1 plan and the coronavirus vaccine plan are modeled off the mass prophylaxis plan.
We really do have people who know what they're doing.
Part of the reason they know what they're doing is because they've done it before. Mary Martin was at the Columbia Boone County Health Department during the H1N1 pandemic in 2009.
I went to flu clinics, I talked to people, I gave them their vaccinations, I watched people that we were watching after the vaccinations.
Though vaccine sites for both pandemics follow a similar model, there are some key differences.
The most difficult part of COVID, it isn't really that it has to be kept cold frozen. It isn't that you have to find people 3 weeks later or 4 weeks later, though that's something we're working on. It's that the vaccinators feel like they have a lack of control.
Part of the lack of control is because of different regulations. Another part is the recommendations of who gets it first. It keeps changing, and both the federal and state levels have their own plans. You might also notice social distancing and PPE like masks and gloves weren't there in 2009.
Because in H1N1, we did have them wait. They were sitting right next to each other, so it throws in the extra complication of yes, you have to wait, and no, you can't. And if they're not in your family unit, we got to put you apart. So,
based on the plans, the health department sets up points of dispensing. Some of them closed at different employers, some open to the public. Some of the potential places for public vaccine clinics include Hickman High School and several other schools across Boone County, the Hearn Center, Memorial Union, and the health department itself.
We would have a vaccinator in every one of our exam rooms. So the people would be brought into the waiting room. They'd be at some station where they'd either have their paperwork already or they'd have to fill their paperwork out. You know, we're talking about online registrations and things like that.
It'd be set up like a loop to minimize contact with others. Patients would then move to a different part of the building for staff to watch for reactions. All of this is adapted from previous mass vaccinations, and health officials say they're ready.
It was practice. It was practice. I don't think anybody is prepared for a pandemic. I think we were better prepared.
Martin told me as long as the vaccines keep getting delivered, everyone in Boone County could get those shots by May.
On our website, you can see more details about the past vaccination site plans, including previous sites used and what the pods look like.